You're welcome back. If you're just joining us, this is Sunday Watch, and we're reaching you live from our studio here in Ikeja, Lagos. I said earlier that we will be considering family planning for couples, and we have someone who is, well, I would describe him as Mr. Capable.
Yeah.
Well, I welcome Dr. Tosi Mohammed Isa. You're welcome, sir, to the program.
Thank you very much. Good morning.
Morning.
Well, I was happy. I don't think I've seen this year.
Okay, that's true. All right, we're looking at family planning for the reproductive, age bracket. If we are taking it from the basics, what should this age group consider before going for a family planning?
Okay, thank you very much. It's quite interesting that the knowledge of family planning has been existing as old as a human being. Because when you trace the history, you realize that at a point, human being also felt that, oh, how do we copulate and then don't have a child? So they just want to maintain the relationship without necessarily having a child. So the effort has on for years. Even our local traditional ways have other ways. They use ring, they use beads, they use so many other things, so many amulets and things like that, all in the name of trying to prevent pregnancy. So therefore means that as a couple, you must communicate. Communication is key. Because what we find in practice is that sometimes the woman comes alone, she wants to do family plan without a husband because the husband will not agree with her. So that's very dangerous. So communication. So when you communicate, both of you agree on the fact that, okay, what exactly are we driving at? We are husband and wife now. So how many children do we want to have? And when do we want to have them? So you can actually plan. That's why it's called family planning. Ability to plan your days and your months and your years so that you can actually take care adequately. So example, as a couple, both of you earning less than ₦1 million put together. So that means you are staying somewhere around Akute or wherever because of your rent capacity. So you must be able to know that how many children you have and then how well can you take care of them. Looking at the fact that as a man, maybe you have other people dependent on you, and as a woman as well, your parents are still there. So you're going to take care of them. Therefore, you need to plan. So what do we do? How many children do we have? So once you have determined that, then both of you should also visit the doctor as well. Most of the time, it's the woman alone that sees us. So we rarely see the men. So she comes alone and says, yes, doctor, I would like to do family planning. We ask her questions. When we got to the point of his husband agrees to this, hey, doctor, if you talk Camille. So that's going to be an issue that she doesn't want us to talk about her husband part because they've argued it severely. There was no proper communication. On that note, we get to tell them that, okay, if that's the case, these are different methods available. And then we look at her state, her size, if she's obese, her medical condition, does she have hypertension, does she have diabetes, does she have any other health issues, or is he HBSS, a sickler? What are the conditions around him? Is he on some special medications? We look at so many factors before we offer them the one that's applicable to them, apart from their own choice. Somebody might be choosing injectables. When we say that, no, we want to do insertion. So it depends on what we are seeing on her that's fitted her. But meanwhile, even after doing that, we give them the caveat that once you start and you are experiencing some side effects, please come back so that we can review or probably change the one you are on, which is very important as regards family planning. Because a lot of people are running into trouble and they do not go back to their provider to give a complaint so that they can actually make a change in what they are using already. So that is a basis for determining how many children do we want to have, how do we plan our lives such a way that we can take care of those children adequately, and we can also enjoy ourselves without necessarily being under pressure. So that is very important for a couple to decide.
Okay, communication. And you did say that most times the males don't come
around family planning.
The what or how can the communication be better passed so that by the woman to convince the man that it is important we both attend this class now, because they have to be educated, they have to be enlightened. It has to go hand in hand.
Exactly. You see, the very easiest way is that from start, when people start as a relationship, do they communicate well? So what's the kind of respect between husband and wife? Do you respect each other? So when you respect each other, then you trust her words and she trusts his words. And therefore, when she said, oh, my dear, I think with the way things is going on, look at your earning, look at my earning, look at the way things in the house, please let us use a method to space these children. So I'm not saying we're not going to have children, but let's space it. So if we have one in 2024, let's wait 2027 for the second one, or like so that we have opportunity of taking care of them. So they start from the way the relationship is built. If couple meet on basis of respect, then there'll be good communication and there's trust. You know, I mentioned 3 things, you know, communication, respect, and trust. You see, there's a chat about love and love and love and love. I said, love doesn't take you far. It's only care. That is the mercy. In marriage, you have love and mercy. Most marriages, you end up on mercy because love will finish at a particular point in time. Therefore, you must have mercy for your partner. So the mercy from the man is like, okay, this man is bearing this baby. The last one she had, she almost died. So why would she have another one so soon when she has not rested? If the man has mercy on her, leave love by one side, then the man will agree, oh, my dear, you cannot have pregnant now. No. Let's space it, okay? Yeah. But when the man also is not carried along, is not even aware of what the man goes through, he might say, what is your problem? After my only had 7 children, and you're telling me here that you want to have only 2. What's your problem? And the family of the husband also is mounting pressure. Fatai, what's happening to your wife? Is that what are you people doing? Are you people doing something different? See, I gave birth to 7 of you. You are number 6. So why are you telling me that you want to have only 2? So they mount this pressure on him, and somebody is telling her to that. But I don't listen to him. So there's a breakdown of communication between them. So there's trust is lost. And then before you know what's happening, the man is not interested in whatever she's saying. So if we want to get them convinced more, that's the beginning. Because sometimes when they come to us, they want us to be the one to talk to the man. We say sometimes it's not easy. To even bring the man to the clinic is a hell. So that's why this your program now you're doing is also an important one that enlightens our people. And some men that listen to it, or some of the men that will get the clips, they should please send it to their husbands who can actually watch it, or their in-laws who can actually watch and talk to their husband. That, oh, you better allow Rebecca to stay cool for it now, because the way it is, last time she bled so much, she received almost 5 pounds of blood before she was discharged. So if that's the case, you don't want this woman to die and leave that other one in your hand and become a father of children without a mother. So you want to prevent some of these issues, and that can be. Then again, our religious leader can do better. And by preaching in the church and the mosque, on the pulpits, as regard the value for family planning. And our community, our chiefs and ballers, and the local people can as well go further to do a lot of that. And in our clinics, doctors and nurses also still do awareness there as regard the importance of family planning. So when all this is put together, the awareness reach the men, those men that don't have time to get to them. And then we can go on social media as well and do more of this. Now, our Nigerian Orientation Agency, the orientation about politics, about economics, they do not talk about population as well. Now, is this a population that is eating bad into our economy? Okay, so if you really want to control those things, go to the grassroots by getting this information to the grassroots, the local environment. Now, all this they are saying here now, the people in the village will not watch this your program, and they're not going to see it. And so, who born the woman to tell the man that he's not ready for sex? Who born you? When in the local area, it's a must that you must always agree for sex, and then and whether you are saved or not saved, then you must get pregnant. Thank God, the man is pregnant again. They celebrate that in the village. The more children you have, that's the more the man shows he's a big man. So if that's the mentality, how do we get over such? You have to take this campaign to the rural area. So maybe LTV might need to have a station in the rural village so that you can actually connect with them.
LTV is actually in those across the state.
So that's how we can get it. Otherwise, those women alone cannot convince those men, I can assure you that. Yes.
Okay.
It's getting more difficult for them.
More of the enlightenment should come from every agency, from every quarter, so that to get to the needed class of people. Now, let's look at the methods of, child spacing in the family. Okay.
There are so many different, there are many methods. I'll give you about 6 or 7 of them. Number 1, we call it emergency contraception.
Emergency contraception.
So that one is what people use today, and sometimes I pity them because the effective rate is just 84% to 85%. So that means that's about 10 to 14% failure. So sometimes it fails. What's the emergency contraception is that, okay, you meet your husband this overnight, and early morning you quickly take these 2 pills and then swallow it, which one they call Postinor, or what you call a post pill. So you take it, it's good for you to prevent pregnancy. So that's emergency contraception. That means you are not sure you are safe, and then the thing has happened already. So you have to take something within 24 hours, and then the rest are assured, or hopefully that, okay, it has worked, okay? The second one is injectables, which fall under hormonals. So that means that we're going to take some things into your body that alter the way your body performs. That's hormones. So it can be injectables whereby we inject you every month, either two months or three months, Depo-Provera, that also prevent you being able to ovulate or prevent fertilization to occur. Or sometimes it can be tablets, which is also made of hormones. The tablet can be combined oral contraceptives or it can be progestin pill alone, whereby once you take it, it alters the environment of fertilization and make it hostile for sperm to fertilize the egg, and so that prevents pregnancy. We also have a patch whereby you attach to your body, and then it's also release hormones to your system that also prevent that. So that's the second one. The third one is barrier method. Barrier method has to do with use of condom and use of cervical cap, use of diaphragm, and use of sponge. So all of these are methods whereby you want to prevent the sperm getting to the woman. So whichever method, either the man is wearing the condom or the woman is wearing the diaphragm or wearing the cap, whichever one, as long as the sperm cannot even reach where the egg is, then fertilization cannot occur. So that's the third one. Then the other one is what's called permanent method. Permanent method is usually not encouraged for the men, because men will not want to do that, as the case may be. But we usually do that for women, especially if she's been delivering by cesarean section, and each of the time is been eventful, whereby we realize that we're doing the third one. The first, second one have been very eventful, so we're doing the third one, then we get to tie our tubes and block the opportunity of getting pregnant again. That is about 99.8% effective, and then so that is done. So such a woman can never get pregnant again, no matter what it does. That also is available for men, where we do what is called sterilization, and then do orchidectomy or whichever form that will do for them, and then that also prevents such a man being able to release out sperm, and therefore it's also permanent. So in African countries, you will not see a man that will opt for that for every reason that's obvious. So that also
it's more on the woman's side.
It's more on the woman's side, yeah, because the woman is the one that's come for surgery. They will take the opportunity of that surgery to do that for her. Then the other one is implant. That means we insert something in the body, maybe IUCD, whereby we insert some ring or some kind of instrument into the system of the woman through the vagina, and then it blocks the chances of getting access between sperm and the egg. Or we insert even in the hand, that's what we call the Nexplanon. So that one also releases hormones and also still block the chances of the egg to meet the sperm. So all of these methods are available, but we selectively determine that based on the condition of every woman. So not all that's applicable to everybody.
Everyone.
So it has to be determined by what is your own condition and which one will be more applicable to you. So otherwise, we will ask you to find out if you have been reacting to some things before. For example, if you react to some of those drugs that are going to be given to you, then you should be stopped from taking that. Example, the risk of some of these things is what is called DVT, blood clotting. So you're at risk of blood clotting. So now a sickler is not supposed to take family planning, okay, because she's at risk of blood clotting already. So then a woman who travel a lot, remember when you travel in the air, you are at risk of having blood clot moving your body. So we get to consider that as well. Then a woman that's diabetic, also we want to consider that also. She's also at risk of blood clotting. Or a woman that's on some medication that promote blood clotting, we also have to prevent that as a matter of fact. Those that have hypertension, also we have to consider that, because with hypertension, some of these drugs aggravate hypertension and then worsen hypertension. And some of them experience also bleeding heavily after insertion or the starting of it. So this bleeding heavily can also be a disturbance to a woman. Sometimes she is not able to even know when she's going to see her menses, or she just gets stained everywhere anytime she's going to menstruate. That can be very disgraceful and very demeaning. On doing that, then we have to also adjust what we're giving to her to change to another one that will not cause other side effects.
Okay. Now, I want to share this scenario. I once had a friend who, you know, after the method that was chosen, the best one chosen for her by her gynae, she wasn't menstruating for a period. Okay. Eventually, she got pregnant. And, you know, initially, she found it pretty difficult to believe that she could conceive. And she had to go back to the hospital where she was advised to keep the baby and, you know, prevent. What could lead to such occurrences? And a lot of side effects too today are being complained about, you know, most women who use all this child spacing methods.
Yeah, the reason is that all family method available has failure rate. All. The only one that is certain, that is sure, is abstinence.
Abstinence.
which is not advisable for a couple. How will you abstain from your wife or from your husband? So even the so-called condom and diaphragm sometimes get leaked or get perforated unknowingly. Okay, so those don't happen. Those are the exceptional in the failure rate. So when it fails, it means that one way or the other, that drug did not prevent completely. It gave only partial prevention. So when you have a coverage of 75%, 84%, 90%, so the remaining percentage that is there that is not covered, those are the ones that comes down with pregnancy, unknowing, and they get surprised. Sometimes a woman was even on IUD, this one will install something in the system, and then she still got pregnant. And she was like, how is it possible? And I said, okay, don't worry. So thank God that at least pregnancy is here. He said, after the last born is about 12 years old, so how do you do about it? He said, well, you have to carry it. And she carried the pregnancy. She delivered, good enough, she did CS to deliver. And then we now do the bilateral tubal ligation for her to finally give her a final closure to pregnancy. So it happens. So the one that experienced amenorrhea, that means not seeing a period for long, yes, it's also possible. It's one of the side effects of the family planning, whereby the period ceased. But we tell them to come back to the hospital because once your period ceases for 6 months, you are entering into another stage in life. And when it ceases for 1 year, in fact, you have entered into another stage entirely. Okay? So you don't want to wait till such level. When you don't see for like 2 months, please go back to your doctor. And then you might need to change that, or you can induce the period to come so that it actually flow back. Because if she's still in reproductive age, definitely she still want to have a child after a while. So we get to make sure that the period is actually flowing well, because that's representation of life system in a woman. So once menstrual has stopped, you get to amenorrhea. That means you're entering into menopause. So once it's 6 months, then you're almost close. Once 1 year, then you have entered into menopause. So you happen to have into what's called premature menopausal stage, whereby at the age of 35, she's menopausal. So, and then that's worrisome. Not that she had a surgery whereby the womb has been removed. So she just been on some medications, and then suddenly period stopped finally, and then she's no more flowing again. So that is early menopause, which can give a lot of symptoms and so worrisome to them. And because of that, you want to prevent that. So they must be closer to their provider who can actually guide them when it's necessary. People should stop going on Google to start looking for answers to those complications.
I will actually get there.
So you better see your doctor, because Google will not be able to explain some things to you, as a matter of fact. And then again, you see doctors who are into this field particularly, not just anybody, who will be able to guide you appropriately and then lead you to what's be successful for you.
That actually answered my question, because I would have asked, you know, the impact of social media when it comes to child spacing. You know, how well should people use those platforms to get themselves enlightened and educated?
They can get enlightened in groups where they discuss it, but not now taking prescriptions and the treatment from there. Yeah, that's wrong.
Okay.
But you can share ideas, listen to other people, what they are saying, what they've gone through, what they feel when they are going through it. Fine, you can learn from there what they did when it happens. But don't be asking doctor there, what drug should I use? What will happen if I do this? There's no way the doctor will be able to give you comprehensive answers or even examine you.
You go to the pharmacy.
Yes, or go to pharmacy and be asking for drugs there. So all of these are local and quack practices. When we go abroad, we don't do that because we don't have opportunity of doing that. So we have to go through the normal route and see professional for your own life, not because of anybody. So to save you from complications, because when complication arises, as I speak with you, just to reveal something to you, since I'm not mentioning them, just yesterday, a woman walked into me and was asking me that, okay, now she's experiencing, anytime she has sex now, she bleeds. So at the age of 29, so what's the problem? And she's been going through this for the last 9 months, and then she hasn't gone anywhere. She's been on social media looking for answers. Until she came to me yesterday, and I said, okay, now if you are bleeding after sex, postcoital bleeding, medically we'll be looking into so many factors. Your age is too young to start thinking of cervical cancer. Cervical cancer is the commonest cause of having to see blood after sex. So for your age, we'll not be looking, are you having the HPV infection, there's the human papillomavirus infection, or are you having a hormonal disorder whereby the hormonal system is imbalanced that's causing all of this, or what exactly is the cause of the problem? But you cannot be seeing blood after sex. It means something is really wrong somewhere. So she might be on some medication, which we are still trying to probe further to identify what's responsible. But imagine the last 9 months, what is going on is more deadly than what you can imagine. So that's why we tell people, do not waste time to see professionals, otherwise you complicate the situation that's minor, which could have been taken care of at a very early stage, and because you are not proactive enough, and it becomes a problem to you.
All right. Ọlọ́run tó yín tẹ̀mí nìkan ṣoṣo.
Ó ní, a dúpẹ́ lọ́dọ̀ Ọlọ́run láàárọ̀ yìí o. nítorí tó ṣe nítorí tí àánú Ọlọ́run àlàyé dúró láéláé. Ẹ wo ṣẹ́ẹ̀tì ẹ̀wá rí èyí tí a gbé wá lónìí èyí tó jẹ́ wípé ó jẹ́ gbajúgbajà ni ó ṣe kókó fún gbogbo wa pátápátá torí bí tá a bára wa dé lórílẹ̀‐èdè Nàìjíríà lónìí ní ìsìn báyìí ó dàbẹ̀ ni wípé òun náà kùn ó dákun náà àbẹ́ ẹ̀ mọ́yé wa ní Nàìjíríà báyìí ní ìsìn ẹ̀ mọ́yé wa ẹ̀ wọ́n tá à ń jẹ wọ́n tá à ń ná ẹ wọlé bó ṣe lọ káàkiri bẹ́ẹ̀ náà ni torí bẹ́ẹ̀ la ṣe wá ní pé ká tiẹ̀ gbé yẹ̀ wò ní àárọ̀ ìkíni tí a lè ṣe sí ìyẹn ní ètò fífi ètò sí ọmọ bíbí. Àwọn bàbá wa náà ti bọ̀ wọ́n ní ọmọ bẹ̀rẹ̀ òṣì bẹ̀rẹ̀ àbí ṣùgbọ́n bàbá sì sọ pé ọmọ bẹ̀rẹ̀ òṣì bẹ̀rẹ̀ bó láyé fẹ́ ṣe sí láàrin ara wa báwo láyé fẹ́ ṣe sí àwọn bàbá àti ìyá ṣáàmù wòra wa lójú náà ni wọ́n ní kò ṣeé wò lójú o fine girl fine boy gan ò ṣeé wò wọ́n dẹ̀rọ pé kẹ́ wá jarun pálura yín ẹ̀yin náà mọ̀ pé gbogbo ẹ̀ máa yẹ kí ni kó jọra wọn ni ṣùgbọ́n tó bá yá jọra wọn lẹ́yìn oṣù mẹ́sàn-án bóyá bèjì bóyá bẹ̀ta ìgbà míì ìbẹ̀rin Ọlọ́run bó ṣe wọ Ọlọ́run náà ló ṣe ń ṣe ọlá ẹ̀ ṣé ká máa wá ba lọ bẹ́ẹ̀ àwọn onímọ̀ sọ wípé a lè ba lọ bẹ́ẹ̀ ló yẹ ká fi ètò sí ọmọ bíbí torí bẹ́ẹ̀ ní àárọ̀ yìí àti lọ pé àwọn dókítà wa tí wọ́n jẹ́ gbajúgbajà nínú ìtọ́jú àwa obìnrin àti gbogbo tó tiẹ̀ ń ṣe wá pátápátá bẹ́ẹ̀ ni gynecologist ohun tí àwọn ṣe kí ni táwọn ń jẹun tọ́lọ́run fún wọn ní ìmọ̀lẹ́ lórí nìyẹn ní àárọ̀ yìí gbogbo ẹ̀yin náà mọ̀ wọ́n bẹ́ẹ̀ ni ojú ni wọ́n ṣàìmọ̀ fọlọ́kọ lórí ètò yìí àti ní gbogbo àwọn ètò iléeṣẹ́ wa ń bì báyìí afẹ́lẹ́ sọ pé dáàdì wa gangan dáàdì LTV ni wọ́n bẹ́ẹ̀ ni bàbá wa dókítà Tósìn Mohammed Isa ẹ̀mọ̀ káàárọ̀ sà.
Àwa ni ẹ o ẹ kú àsìkò yìí.
A kú àṣekù ọdún.
Àwa ni ẹ o Ọlọ́run ajé apẹ́láyé o.
Àmín Ọlọ́run.
Lórí àlàáfíà àti
àmín Ọlọ́run àmín Ọlọ́run. A dúpẹ́ nítorí pé mọ́mí aláwọ̀ yín pé kí ẹ tètè jí wá bá wa láàárọ̀ orin kò yìí sí
a dúpẹ́ fún wọn.
Ẹlí mọ́mọ́ mọ́mí ẹ ṣé mà a dúpẹ́ mà a kò yìí sí o ẹlí mọ́mọ́ à ń sọ èrò ètò fífi ètò sí ọmọ bíbí sà kí tiẹ̀ ní àwọn àǹfààní tó wà ń bẹ̀ gan torí èlò ọkùnrin mi àti kí ẹ̀ nẹ́ níbo tọ́lọ̀ mẹ́ni o tọ́lọ̀ ń bá ní bí ni àkìlódógbò bá lè bí máa ẹlòmíà ẹ gbọ́ kí ni àwọn àǹfààní tó wà ní ká fi ètò sí ọmọ bíbí.
Àǹfààní tó wà nínú ètò ọmọ bíbí ó pọ̀ alákọ̀ọ́ ni pé kí ni ń jẹ́ bẹ́ẹ̀ tó ń jẹ́ bẹ́ẹ̀ ni pé ìní ìpinnu pọ̀ láàrin ọkọ àtaya lórí pé ọmọ mélòó la fẹ́ bí ìgbà wo la fẹ́ bí.
ṣé pé ká tó fẹ́ra.
Lẹ́yìn pé ẹ ti ń fẹ́ra lọ́wọ́ kó tó di pé ẹ gbéra sílé ó yẹ kí rọrùn ọ̀rọ̀ báyìí ti jáde tí ò bá wá jáde kẹ́ tó wọlé bí wá ṣe ń wọlé lára àwọn ọ̀rọ̀ tó yẹ kó jáde torí pé ìbálòpọ̀ máa bẹ̀rẹ̀ tó bá sì bẹ̀rẹ̀ oyún máa tẹ̀lé tó bá ti ń tẹ̀lé agbọ́dọ̀ jọ ti ní ètò pé ní ọdún yìí ò tá bá ti ṣe lọ́dún yìí pẹ̀lú ìwọ lọ́jọ́ àfọdún 2-3 sílẹ̀ ká tó tún ṣe mí ṣùgbọ́n láàárín yẹn kókè làwọn ṣáà máa wọra wa níbẹ̀ ṣe bẹ̀rẹ̀ àdàmọ́ra olójú ìyẹn ló mú ọ̀rọ̀ fètò sọmọ bíbí wa pé àwọn ìlànà tó wà nílẹ̀
ọ̀nà wo la wá fẹ́ fi ṣe
lè lò pé ok láàárín ìgbà tá a fẹ́ fi àsìkò lẹ̀ tá a fẹ́ bímọ yẹn
bí abẹ́ ọdún 2 síra
kí la fẹ́ máa ṣe tá a fẹ́ ní lóyún àwọn yẹn ní ìjọba àti onímọ̀ ìjìnlẹ̀ sáyẹ́ǹsì lọ́dọ̀ àwọn dókítà ti gbé gbogbo àwọn ètò yẹn kalẹ̀ lóníranran nítorí pé ètò tá à ń sọ ó ti wà ká láyé táláyé ti dáyé àwọn bàbá náà ti ń lo ìgbàdí wọ́n ń lo òka wọ́n ń lo àkàràbà wọ́n ń lo ńdè wọ́n ń lo oríṣiríṣi láti
àwọn àwa gan ń lo lẹ̀kẹ̀
lẹ̀kẹ̀ so láti lo pé kóbìnrin má lè lóyún ó túmọ̀ sí pé láti gbà yẹn làwọn náà ti ṣàkíyèsí pé tí kìíní yìí bá pọ̀ jù nílẹ̀ ó lè padà ju ọwọ́ wa lọ omi lè padà ju gàrí lọ fún àbá ti bẹ́ẹ̀ so àwọn ìlànà tó wà nílẹ̀ pọ̀ àpẹẹrẹ nínú ẹ̀ òun ní ìta ń pè ní pàjáwìrì yẹn náà ní ìfèsọmọ bí onípàjáwìrì àjọṣepọ̀ láàárín ọkọ tóbìnrin tó bá wáyé tóbìnrin rí pé ó dàbí pé nǹkan tó ṣẹlẹ̀ yìí òun lè lọ tara ẹ̀ lóyún àwọn kóró tábìlẹ̀tì wà tó lè lò láàárín wákàtí mẹ́rìnlélógún
kí wọ́n tó ríra àbí tán bá ríra
tán lẹ́yìn tán ríra tán ẹ̀ náà tí wọ́n ṣe máa ń pè ní emergency yẹn náà ní pàjáwìrì so a sáré lò tó bá ti lò sí ìyẹn aṣẹ kíni o a kọ́ di oyún láàárín eléyìí sì dá púpọ̀ nítorí pé kí ni kò tí ì fún àwọn tó jẹ́ ẹlẹ́sìn tó ń pè bí akéèyàn máa ṣẹ́yún torí eléyìí kò mú ọ̀rọ̀ ṣẹ́yún dání kò ní jẹ́ kó doyún ni tó sì fi ọkàn yàn balẹ̀ pé òkè kò sí wàhálà ń bẹ̀ lẹ́yìn yẹn a máa ń pè míì ní tó pé àbáláyé tó pé natural iná tàbí níbí ìyẹn náà ló wà lórí pé fún àpẹẹrẹ kóbìnrin mọ àwọn àsìkò tí ó lè lóyún àsìkò tí ò ní lè lóyún tó sì máa wò pẹ̀lú bí ara ṣe ń ṣe yẹ lápẹẹrẹ àwọn tá à ń pè ní temperature ìyẹn náà ní bára ṣe ń lọ́wọ́ sí so ó máa ń yí padà nígbà tó bẹ́yìn bá wà ní àforífojì tó lè lóyún tó bá tó wà ní agbègbè yẹn á sọ fún baálé pé má jẹ́ àṣekínní lásìkò tó bá dábàá lọ ṣe ó máa doyún so irú yẹn náà a máa ń lò ṣe pé bí ara ṣe ń ṣiṣẹ́ sí
lẹ́yìn
ara obìnrin ló máa fi
mọ̀
ṣùgbọ́n a ti ní instrument tó lè fi máa check ara náà tó máa fi mọ̀ pé àsìkò tí mo wà yìí mo ti ń ṣe kíni o mo ti ń release ẹyin so mi gbọ́dọ̀ láṣepọ̀.
so àwọn irinṣẹ́ kan ti wà tá a lè fi mọ̀.
tẹ́lẹ̀ tó lè fi mọ̀ ó máa fi sójú ara rẹ̀ ládẹ̀ wo temperature pé kíni ìdí yàtọ̀ ó túmọ̀ sí pé
dájú ò lè súnmọ́
wa so ìyẹn náà wà. ẹlẹ́ẹ̀kẹta òun náà ni ti alábẹ́rẹ́ àbí tó ní tablet yẹn máa lò tó ní àwọn èròjà nínú tá à ń pè ní hormones àwọn náà ní chemical tí pé ó lè yíra padà àwọn eléyìí náà wà tẹ́ pé ó ní tablet wọn lọ lójoojúmọ́ ayé tó gbọ́dọ̀ lọ ẹ̀kan lójoojúmọ́ ó ní abẹ́rẹ́ olóṣù mẹ́ta wà abẹ́rẹ́ olóṣù méjì wà ìyẹn náà wà tá máa ń lò lẹ́yìn yẹn ó ní ìdáàbòbò wà tọkùnrin lè wọ̀ èyí tá à ń pè ní láìlọ́nù ìdáàbòbò obìnrin náà ní tiẹ̀ à ń pè ní cervical cap à ń pè ní sponge oríṣiríṣi ló wà fún obìnrin ṣùgbọ́n tọkùnrin ló fẹ́ gbájúmọ̀ ìtàn pè ní condom tó pé ọkùnrin tó bá ti wọ̀ ìyẹn túmọ̀ sí pé
fèrè tí ẹ ní àwọn bàbá wa.
àtọ̀ ọkùnrin onílẹ̀-èdè ibi tí ẹyin obìnrin wà so ìyẹn tó fún wọn láǹfààní ṣùgbọ́n èyí tó wá borí ẹ̀jù ni ìta máa ń ṣe tẹ́ pé ní pátápátá tẹ́ pé fóbìnrin tó bá ṣe operation á lọ mú ibi okùn ẹyin ibi tó ẹyin ń gbà wọlé ọmọ á gé ibẹ̀ á wà sọpa tábà ṣe bẹ́ẹ̀ fóbìnrin irú obìnrin bẹ́ẹ̀ àti lóyún òsì mọ́ láéláé nìyẹn àyè àbáfíà náà wà fọkùnrin náà a lè ṣe fọkùnrin náà tẹ́ pé àwọn ibi tí àtọ̀ ti ń jáde á gé ibẹ̀ á sì sopa so àtọ̀ lè jáde síta mọ́ nìyẹn tó túmọ̀ sí pé irú ọkùnrin bẹ́ẹ̀ àti tẹ̀lọ́dà so irú èèyàn bẹ́ẹ̀ kò lè fún obìnrin lóyún mọ́ so àwọn gbogbo ọ̀nà táwa kalẹ̀ yìí ló ní àwọn ìpèníjà nú ara bẹ́ẹ̀ ló sì ní àwọn ìlànà tí wọ́n tún ṣe kí ni tí wọ́n fi ń mẹ́hẹ̀ so láwọn ọ̀nà tí wọ́n fi ń ní àwọn ìpèníjà ara ó ṣeé ṣe kí obìnrin máa bẹ̀rẹ̀ sí rí ẹ̀jẹ̀ tó pọ̀ jù àbí ó tẹ̀ ṣe pé kí nǹkan oṣù tẹ̀ wá sí pátákó kó má tẹ̀ wá mọ́ àbí ńgbà mi kó bẹ̀rẹ̀ sí máa sanra sí àbí ńgbà mi kó tẹ̀ máa gbẹ àbí ńgbà mi kó tẹ̀ pé bóyá àwọn nǹkan mi tó máa tẹ̀ ṣe àwọn oríṣiríṣi amáṣẹ́lá tí ò ní lè ṣàlàyé tó túmọ̀ sí pé nǹkan tó lò ló fà á àǹfààní ni pé padà lọ báwọn tó fi sí ẹ lára padà lọ báwọn tó tán fún ẹ lóògùn báyìí ló ṣe ń ṣe mí o wọ́n á yí padà torí kan tó fún ẹ náà tẹ́lẹ̀ wọ́n á ti ṣàyẹ̀wò ara wọ́n á ti béèrè ìbéèrè wọ́n á béèrè ìbéèrè rẹ̀ bẹ́ẹ̀ láti mọ èwo ló bá yẹ lára mu tó wọ́n sì fún ẹ tán máa pé tó bá fẹ́ yíwọ́ láàrin oṣù 2 sí 3 padà wá bá wa ká lè ṣe àtúnṣe ilé lórí so ìyẹn wà bẹ́ẹ̀ nígbà míì náà ó lè fà á kóbìnrin jẹun tó gbé kíni kó máa bẹ̀ sí ní ẹ̀fọ́rí góóró tó pé òye gan tó lè fà kó tún ní ìfúnpá gíga ìjọ ríru tó bá ti fẹ́ díbẹ̀ lọ bá wọn padà wọn á ṣàyípadà lé lórí kó lè bá dẹ́kun kó má bàa ní wàhálà nígbà míì sì ni ó lè ṣokùnfà ẹ̀jẹ̀ dídì inú ara tí lè lè fa cardiac arrest tó yẹ kó lè fa ikú lójijì lọ rí wọn kán lè tètè ṣètò lórí pé kí ẹ̀jẹ̀ dídì inú ara kó má bàa ṣe tó máa ṣokùnfà ẹ̀ so àwọn eléyìí ní àwọn ọ̀nà tó wà nílẹ̀ tí ọkọ àti ìyàwó tí wọ́n gbọ́dọ̀ jọ mọ̀ ṣùgbọ́n ó dáa kọ́kọ́ náà nígbésẹ̀ tí wọ́n jọ máa gbé kó má yẹ pé ìyàwó nìkan ló máa lọ.
bàbá wa ẹ má bínú a rí wípé ní ọ̀pọ̀lọpọ̀ ìgbà tí a bá ń sọ̀rọ̀ nípa ètò fètò sọmọ bíbí pé ní ọ̀rọ̀ ti olóyìnbó dé a rí pé àwọn obìnrin nìkan ni wọ́n sábà máa ń lọ pé èmi mo fẹ́ lọ sí ọsibítù bá bẹ̀ wọ́n títí ó lè má dáhùn ó sì lè dìjà ó lè di pé mo ti ẹ̀sìn rẹ̀ tó jẹ́ sọ pé ṣé lórí ọ̀rọ̀ yìí ṣá kò sí wàhálà màá bẹ́ẹ̀ wá búrò ó dàbẹ̀ ni pé ó rẹ̀ wọ ni ọmọ tí ò ní rẹ̀ tí ara tiẹ̀ ti pè màá bẹ́ẹ̀ wà ṣé mo pé obìnrin bẹ́ẹ̀ á yà lọ fúnra rẹ̀ kò ní bẹ dádì wọn kí ló dé tó fi jẹ́ pé àwọn ọkùnrin wà wọn ò fẹ́ lọ ṣáwọn náà wọn ò fẹ́ àbí torí èmi ní pé tá a bá ti fi ètò sí bóyá ọdún méjì sí mẹ́ta á rí i pé ọkùnrin gan fúnra rẹ̀ gan owó gan á wọ́wọ́.
a ní sinmi.
ìsinmi gan dé baálé òní gùn lọ́rùn wéré káàkiri àbí àwọn ọmọ wọn ní máa dàbẹ́ ni pé wọ́n fẹ́ máa pọn wọlé ra wọn ju bó ti yẹ lọ bóyá wọ́n jọ papọ̀ ní kíláàsì mi ìṣẹ̀mọ̀ ká mọ́ṣẹ́lẹ̀ ńgbà mí. ṣùgbọ́n wọ́n kọ́ wọ́n ti fètò sí dáadáa ẹ rí wípé àbúrò àwà láyé tiẹ̀ ẹ̀gbọ́n náà wà láyé kálukú á máa bá a lọ bẹ́ẹ̀ ṣùgbọ́n kí ló táwọn dáàdì wa máa ń yarí lọ́pọ̀lọpọ̀ ìgbà.
nǹkan tó fà á ní pé láti ìpìlẹ̀ wa àwọn obìnrin gbọ́n jọkùnrin lọ.
lọ́nà wo.
tẹ́ bá lọ sọ́sibítù obìnrin ló pọ̀ jù láti pọ̀ wọn lára wọn ò yá jù ní ó tì ó torí pé obìnrin gbọ́n jọkùnrin lọ tí nǹkan bá ṣobìnrin kínkínní ó ti dọ́sibítù.
kíákíá.
ṣùgbọ́n ọkùnrin tí ò bá tí ì fẹ́ kú kì í lọ sọ́sibítù. ìyẹn ló já sí pé tí obìnrin máa bá sọ wá sọ́sibítù tí wọ́n admit wọn sọ́sibítù àwọn mẹ́wàá ló padà lọ́lé tọkùnrin mẹ́wàá bá wá sọ́tọ̀ wọn admit wọn àwọn bíi 9 wọn yóò kú ìkọ́nú padà lọ́lé tó túmọ̀ sí pé àwọn ọkùnrin tí ń wá yẹn ó ti wọ̀ wọ́n lẹ́wù ó ti wọnú àgọ́ ara kan tó dé so ìyẹn fi yé pé obìnrin gbọ́ ju ọkùnrin lọ
nínú ètò ìlera
lórí ìyẹn lọ́pọ̀lọpọ̀ ọ̀nà náà lọ́ọ́ fi gbọ́n ọkùnrin lọ so lórí ìyẹn wọ́n á fà á tó yá sí pé lórí ọ̀tọ̀ ọmọ bíbí obìnrin ló rí ibi tí nǹkan kù sí jù òun náà pé baálé yìí ń ṣe wàhálà ó jẹ́rìí láago 6 àárọ̀ ó láago 11 ó rí pé alátàrákùnrin ṣe pọ̀ jù àwọn dẹ̀ ń bí mọ́lẹ̀ rẹpẹtẹ òun ló máa ń wọ pé kò yẹ ká kí ní ìmọ̀ lọ sí báyìí jẹ́ ká gbọ́gbọ́n dá sí i ṣùgbọ́n bàbá yẹn òun ti gbọ́ láti abúlé wa pé bọ́n bá ṣe pọ̀ sí lówó ṣe ń pọ̀ sí
bẹ́ẹ̀ni
so wọ́n fẹ́ bí tó pọ̀ sí bẹ́ẹ̀ni so ìyàwó yẹn ló mọ wá ṣe gbìyànjú tó bá bá sọ̀rọ̀ ibi tí wàhálà wà ní pé kì í gbọ́ kò ní gbà pé ìyá tó bí mi àwọn 8 ló bí èmi lọ́mọ 7 màmá tiẹ̀ náà ẹ̀yin 7 ló bí ìwọ lọ́mọ 6 wọ́n fẹ́ sọ pé afẹ́ bí 2 3 kí ló fẹ́ farú yẹn àbí ń gbà mí pàápàá nítorí pé kò sí ìfọkàntán láàrin wọn pé bí obìnrin fẹ́ lọ máa ṣe ránu ló ti fẹ́ ṣe family plan ìyẹn tó dé wàhálà mi lọ rẹpẹtẹ pé àwọn onírànú ní torí pé fẹ́ lọ máa bọ́kùnrin lọ mi ṣe pọ̀ ló fà á tó fẹ́ ṣe nǹkan tó bá mọ̀ lẹ́yìn pé tó lọ ṣe lẹ́yìn eléyìn àtú wàhálà yẹn máa dé so ìyẹn la fi sọ pé ó dáa kí obìnrin bẹ́ẹ̀ kó tiẹ̀ pé láti pẹ̀lẹ́ fẹ́ lọ rí dókítà pé òun àtọkọ ẹ̀ lọ́wọ́
jọ lọ
dókítà á lè sọ ojúṣe kálukú fún wọn àti ìdí tán ṣe gbọ́dọ̀ ṣe ètò fún ọmọ bíbí tí dókítà bá ṣàlàyé fún ọmọ méjì lójú àwọn méjèèjì wọn á jọ dé lọ máa jọ gbé yẹ̀ wò dókítà sọ báyìí o dókítà sọ báyìí ìyẹn ló máa jẹ́ kó
pé èwo ni kí wọ́n lò ńgbà míì náà a rí wípé gbogbo àwọn ètò yìí bó ṣe dáa tó ìgbà míì yẹn àti wò pé kí mu tiẹ̀ wá kí mu bá ka kí mu tún ṣe fún tó jẹ́ pé ẹlòmíì tó bá ṣe tán lẹ́yìn tó ti ṣàyẹ̀wò tán ni o á máa wá gbẹ ní tó bá fẹ́ gbẹ ìmí ìgbà yẹn á wá yalẹ̀ àwa tóbi kí ló tún wá tún fa gbogbo àwọn kùdìẹ̀kùdìẹ̀ báyìí.
àwọn àjẹbọ àti àwọn ìpèníjà àwọn kinní yẹn nìyẹn tí obìnrin bá ti mọ̀ kó tó bẹ́ẹ̀ kò ní dàlámù kò ní jẹ́ lójú á tẹ̀lé májẹ̀mọ́ tí wọ́n sọ fún àpẹẹrẹ nìsín ẹni tí ó gba alábẹ́rẹ́ tó ṣàkíyèsí pé wọ́n ti ń tóbi sí kó má dó tó máa fi tóbi jẹ́ tó máa tí ò ní lè gbẹ́ náà kó tó lọ bá àwọn dókítà padà pé ẹ wá ń bí o ẹ wo 78 ní weight mi kí n tó bẹ̀rẹ̀ nísìnyí tí mo 110 ẹ ṣàánú mi kó máa dòdò bàtà 120 tó máa bẹ̀rẹ̀ sí ní máa mí tí ò ní lè mí kan lẹ̀ mọ́ tó bá ti lè ṣe yẹn ẹ rí i pé kí a máa yọ kúrò wọn á yí padà sí oríṣi míì tí ò ní lè dá nǹkan bẹ́ẹ̀ yẹn sí lára ṣẹ́rí gbogbo oògùn tá a bá ń lò pátá ló ní àjẹbọ̀ náà kódà paracetamol tó kéré jù ó máa ń kọlu kíndìnrín kó tó ṣiṣẹ́ náà ara bí wọn bá lò lálòjù á dá wàhálà alẹ̀ so wàá lọ bèèrè lọ́wọ́ dókítà kí ni mo tún lè lò fún ara tó ń ro mí tí mi ò ní fi oògùn ara ríro kó bára mi so tó bá ń lo ẹnu tí gbogbo tó bá wọn tó bá lò lè lò tó bá máa kó palára báyẹn lọ bá àwọn tó fún ẹ padà wọn á yí padà sí ìmíì tí ò ní lè pọ̀ lára báyìí bó ṣe kú rí nìfín tó bá lẹ́kọ̀ọ́ má gbọ̀nà kẹ́míìsì rẹ pé ẹ wò ilé ni mò ń lọ tó fún mi ní mi ìyẹn kọ́ náà bí ń ṣe ètò tí ò bá ṣe bẹ́ẹ̀.
ṣùgbọ́n lóyún ìgbà míì ẹ̀rọ ayélujára alágbèéká tá à ń gbé káàkiri yìí ó mọ̀ ti dá oríṣiríṣi nǹkan sílẹ̀ sí ara obìnrin mi àwọn ni dókítà obìnrin mi àti ṣe báyìí kankan lámà àbí mẹ́ta àwọn náà wà gbé oríṣiríṣi jáde fún kódà títí kò oògùn gbà míì títí kewé àtẹgbò ẹ bá ń bá wọn sọ o àwọn ọ̀nà yìí o.
ṣe rí social media àti AI ó wà fún ìdàgbàsókè ẹ̀dá ṣùgbọ́n fẹ́ni tó bá mọ̀ ọ́ lò tó bá lò lọ́nà tí ò dá àkóbá ẹ̀ àìmọye tó ti lọ wo lórí Google pé kí ló ń ṣe òun tẹ́ pé ìbẹ̀rù tó kà ń bẹ̀ kò sùn mọ́jú ẹ̀mí sì ní àsìkà mi àlọ́ fọkàn ẹ̀ lórí nǹkan tó yẹ pé ó máa pa torí pé àwọn kan yẹn àwọn tó kọ́ ibi tẹ̀ ń kà ní tí wọ́n rí lọ́dọ̀ wọn ni wọ́n kọ síbẹ̀ tẹ́yìn máa kà ṣùgbọ́n tẹ́ bá lọ rí dókítà tó kọ́ṣẹ́ mọ́ yẹn tẹ́ bá jọjọ sọ̀rọ̀ a lè yẹ̀yìn wàá mọ̀ pé títí yìí báyìí ló ṣe rí ṣùgbọ́n yìí máa lọ ka Google àti pé wọ́n máa béèrè oògùn lọ́wọ́ Google kódà àwọn ọmọ ìsìn wá débi pé wọ́n tún ṣe Google débi pé wọ́n ní kí fẹ́másì kó gbógun wálé fún wọn àwọn oògùn burúkú tẹ́ pé dókítà gun ò gbọ́dọ̀ kọ fún èèyàn wọ́n máa gbé wá bá wọn lé arábìnrin kan fẹ́ lóyún ó wá lọ ó mọ abẹ́rẹ́ kan tó máa ń fọ̀n tó bá fẹ́ ṣe IVF tó máa ń jẹ́ kí obìnrin lè ní ẹyin tó pọ̀ wà ló ń gba ògùn yìí ọmọ àgbẹ̀ alẹ́ fún ọdẹ ń gún ara ẹ̀ ó gún ara ẹ̀ tó pé bí ó fẹ́ tó bí 28 injection tó fún ẹ̀ ilé ẹyin wa tóbi ra bàtà inú wa ga rẹpẹtẹ wà mí hẹ̀ wà oyún náà gùn wà wá mọ́ so ọkọ dígan kò lè láṣepọ̀ pẹ̀lú ọkọ ẹ̀ mọ́ bolo ti rógùn ó náà máa ń ọ̀dà fún látòrí gbogbo ọmọ àgbẹ̀ abáwọn ìyẹn túmọ̀ sí pé ọ̀pọ̀lọpọ̀ ti fọ́ ara ẹ̀ ṣe rẹ̀ lórí pé àmọ̀jù nínú ìmọ̀ àti bíbẹ alábẹ́jù lórí nǹkan tí yóò kọ́ṣẹ́ mọṣẹ́ nípa ẹ̀ ó máa ń padà kó báyọ̀ ni ṣùgbọ́n tí yẹn bá ṣe alásùnmọ́ àwọn tí wọ́n kọ́ṣẹ́ mọṣẹ́ èlò ló máa ná ẹ kó rí dókítà èlò ló máa ná ẹ kó wọ́n san tó ṣe ẹ èlò ló máa ná ẹ kó ṣàyẹ̀wò lórí àwọn nǹkan tí wọ́n rò tó ń ṣẹlẹ̀ ní àgọ́ ara ẹ̀ tó o bá ṣe léyìí tó fẹ́ fò kọjá tó fẹ́ ọmọ tí ò bá fẹ́ fà kó tó rìn yóò padà wá fà tó bá dọjọ́ iwájú so ìyẹn ló fà.
bẹ́ẹ̀ni yóò padà jálulẹ̀ náà ni kọ́lọ̀ ṣàánú wa ní kó tó di wípé bóyá èdìdì sà èmi fẹ́ pé kí ẹ bá ń bá àwọn èèyàn wa gan sọ̀rọ̀ torí ṣe mọ̀ wípé gbogbo àwọn ilé ìwòsàn wa kéréje yìí nígbà míì táwọn èèyàn wa bá lọ síbẹ̀ bàbá wa mo ń sọ lójú yín báyìí ní kí bàbá náà máa gbọ́ gómìnà wa bí gómìnà wa ṣe ń ṣe tó bí wọ́n ṣe ń ṣàkìtìyàn tó ó dàbẹ̀ ni pé àwọn èèyàn wa ní bóyá lẹ́sẹ̀ kùkú ni àwọn ilé ìwòsàn tó wà ń bẹ̀ àlàyé kò kún tó fún àwọn èèyàn tó ń wá gbàwòsàn ń bẹ̀ kí ni tó dé àwọn mi wọlé tí ń ti pọ̀jù kí ló dé ẹ̀yin ń gbọ́ràn lẹ́ǹkan ni ṣe mọ̀ wípé ọ̀rọ̀ yìí sì rèé ó gba pé ká farabalẹ̀ bẹ́ẹ̀ yẹn farabalẹ̀ yìí stúdíò lẹ́wà o tábà wá bá yín nínú ọ́fíìsì nǹkan wá rí pé ó tún yàtọ̀ ju báyìí lọ ṣùgbọ́n àwọn ò ní farabalẹ̀ kankan rárá bóyá torí ilé làwọn èèyàn wa ò ṣe kì í lọ sọ́dọ̀ wọn pé ẹ wo mi ìfẹ́ kéèyàn kọ́ ọmọ kọ̀ọ̀kan máa rìn mi fi ń jàre wò jẹ́ kí n ya lọ sí Google tèmi ṣe é mọ̀ ń gbà mí.
ṣe rí àgbègbè tí ẹ sọ̀rọ̀ sí yẹn a máa dúpẹ́ fún ìjọba lórí gbìyànjú pàápàá jùlọ ní Lagos State ṣe rí èrò tó wà ní Lagos State tí máa pọ̀ kì í máa ṣe kékeré àwọn òṣìṣẹ́ tí wọ́n gbà wọ́n máa ń gbìyànjú gbogbo àwọn máa ń gbé òṣìṣẹ́ sí ṣùgbọ́n òṣìṣẹ́ ìlera ṣe wọ́n ti kúrò Nàìjíríà tán báyìí nísìn torí àwọn ìlú tó kù náà torí owó nìkan kọ́ torí àwọn ìlú tó kù wọ́n bùkátà sí àwọn òṣìṣẹ́ sọ wọn mọ Nàìjíríà tó ń pè ibi tí iṣẹ́ bá wà tí ò ní wàhálà tó ti Nàìjíríà jẹ́ ń gbàbẹ̀ lọ so torí náà a máa kí àwọn tó wà ń bẹ̀ tán gbìyànjú náà ni o ṣùgbọ́n a tó rọ̀ wọ́n pé kán ṣe sùúrù kán ṣe sùúrù torí pé ọ̀pọ̀lọpọ̀ àwọn èèyàn tó wá ń bá wọn yìí wọn ò nígbòmí tó ń fẹ́ lọ́nà tí wá bá wọn.
bẹ́ẹ̀ ni àwọn náà fi iṣẹ́ sílẹ̀ náà wá.
tó máa wá dọ́dọ̀ yín ẹ ṣàlàyé fún Ọlọ́run tó máa fi yé wọn tó máa tún béèrè ẹ má kanra fi dá wọn lóhùn pé àti mo ti sọ léyìí tẹ́lẹ̀.
ẹ̀yin ń gbọ́ràn lẹ́ǹkan ni.
torí pé ọ̀rọ̀ tẹ́ ẹ̀ ń sọ náà ṣẹ̀ṣẹ̀ ń gbọ́ ni wọn ò gbé ẹ̀yin ti gbọ́ nígbà àgbà ó kò jọ yín lójúmọ́ ṣùgbọ́n ẹni tẹ́ ẹ̀ ń bá sọ̀rọ̀ ó ṣẹ̀ṣẹ̀ ń gbọ́ láwọ̀kọ́ ni torí pé ń gbọ́ láwọ̀kọ́ lè má tètè yé lọ síbi tó yẹ bó ṣe yẹ kó yé sí torí gbogbo wa nìkan máa ń yé gbà kan náà ẹlòmíì tí wàá gbọ́ lẹ́ẹ̀mejì lẹ́ẹ̀mẹ́ta kò tí ì ní yé dáadáa so tíyàn bá farabalẹ̀ á padà yé àwọn èèyàn tó rọ́pọ̀lọpọ̀ náà tí wọ́n lọ ń ṣe tó wù wọ́n gẹ́gẹ́ bẹ́ẹ̀ ṣe sọ nítorí pé wọn ò rí ọ̀nà àbáyọ ní ilé ìwòsàn tìjọba wọ́n ṣe ń wọ́n ọ̀nà àlùmọ̀kọ́rọ́ yìí láti wá ọ̀nà sí ọ̀rọ̀ ara wọn torí pé èèyàn ní lájọ́ ẹ̀kẹ́ta ló bọ́ wọnú ẹ̀ tó bá rí pé nígbà tó dẹ̀ pé adé hospital wọn ọ̀dà lóhùn dáadáa àti pẹ́pẹ́pẹ́pẹ́ wọn padà ṣe wọn fún wa ó jẹ́ ìwọ̀n kan lòjàre má ṣe mí léṣe ìyẹn ló fà á tó yẹ pé táwọn èèyàn bá farabalẹ̀ wọ́n á rí ẹ̀kọ́ kọ́ ní ilé ìwòsàn tìjọba táwọn bá rí ní health center wọ́n á rí ní general hospital táwọn bá rí ní private hospital wọ́n á rí ní health center táwọn bá rí ní health center wọ́n lọ station hospital àwọn gbogbo àwọn àyè yìí ló wà fún láti wọ́ ìjọba láti dẹ́kun pé káwọn èèyàn má fọwọ́ ara wọn ṣe ara wọn lórí ọ̀rọ̀ ìlera ara wọn torí pé àmọ̀jù ìmọ̀ fún ẹni tí ò kọ́ṣẹ́mọṣẹ́ ó máa ń padà kó báyàn ni o.
ó kọ́ àpadà kó bá ní nítorí yẹ káná tọrọ lé káná kọ́bọ̀ lé amọ̀lé mọ́ ná mílíọ̀nù lé lórí kọ́lọ́hún ṣàṣàánú fún wa ni ẹ ṣé gan ni bàbá wa àdúpẹ́ nítorí wípé ẹ jẹ́ wa àmì sì mọ̀ wípé ọgbọ́n ìmọ̀ àti òye Ọlọ́run mọ̀ ṣàlékún ẹ̀ fún ilé àtọ̀nà yóò sì ní dàrú bẹ́ẹ̀ tí ń tún lè kálukú ṣe Ọlọ́run àtún lè ti ẹ̀yin náà ṣe. First Lady.
All right. Okay. Thank you very much, sir.
You're welcome.
For, thus far you have taken us. I just want you to, a lot have been said. One, majorly, enlightenment.
Yes.
Communication, which is the basic of any form of family planning. To either reproductive couple or those who have felt, say, look, we have come a long way. Let's communication is key. A lot of young people are still out there. They will still, feel I'm not safe. I will still maintain my natural self. How will you go about, changing their orientation in embracing family planning, a method assuring them that, the experts are there to, get in touch with you directly and tell you which one is most suitable for you without any side effect. There are a lot of negative vibes out there when it comes to, yes, most of this method from the young ones. So they would rather prefer to, remain in their shelf than coming out to speak out. What will be your advice for them?
My advice for them is very simple. By showing them those that eventually got pregnant and that decided to do abortion and what happens after abortion. So when you see, sometimes we call what was called a method called worst case scenario. So if you say you don't want to experience some of those family planning methods, and you want to take things by yourself. So in case you get pregnant, you are likely wanting to remove the pregnancy. Now, removing the pregnancy will give you a long list of associated risk, either immediate or long term. And when you see those ones, that can actually bring you back to say, oh, it's better I prevent the pregnancy than removing pregnancy. Okay? Some have removed pregnancy and now they never get pregnant again. Some have removed pregnancy and they die in the process. Some have removed pregnancy, they develop complications that will not make them to get pregnant forever. So you don't want to tilt your life into that permanent negative by yourself. Instead of doing that, why don't you prevent the pregnancy from start and embrace one of the methods that is useful, especially if you don't want to use any drugs. The natural methods are there. So you have to learn your ovulation time, the rhythm methods, the temperature method, the mucus plug method. All of this will teach you how it works. You'll understand it, and then you can combine that even with condom, whereby you already know your safe period, and the man still have to wear a condom. So you are combining two methods together. Then you are safe from the side effect, because those two don't have side effect. Yes, you cannot be using natural method and condom have side effect. No, there's no side effect. Whereas those other methods that exist have a lot of side effects. So you have these two that prevent side effects. So we can embrace that one that helps you to maintain your body without any changes. And that is better for you than getting pregnant and you start seeking doctors removal of pregnancy. Couple come to doctors, married couple, young married couples want to remove pregnancy. And sometimes it runs us mad. I say, you just got married about a year ago and you want to remove pregnancy. What exactly was going on in your mind when you guys are having sex? So is it that you don't know that you're going to get pregnant, or what did you get married for? So it's because they were not well tutored and they're not well oriented as regards the purpose of marriage and the purpose of sex, and so they did not know the result of sex is pregnancy. Now you got pregnant at the early stage of marriage and you want to remove it. So it sounds very absurd. It's because either of the two are not well tutored as regards what it entails to be a family or a couple, as a matter of fact.
All right, thank you very much. All right, from all said, family planning is essential. For the mental well-being of the couples, for growth, for development of not only the family now, but the entire nation. All right, that will be the size of our program this morning. We'll see you again next week by His grace and sure. You are the best you can give the country called Nigeria. Plan your family well, and you will eventually get the result. It's almost immediate, because the size of your family will not be too large and out of control. All right, Anita Buhari is my name. Enjoy the rest of your weekend and have a fantastic week ahead.
Bẹ́ẹ̀ni, adúpẹ́ púpọ̀ ní owó Ọlọ́run. Abẹ́ẹ̀rí nǹkan tòní. Òtòní dùn. Mo sọ abẹ́ẹ̀rí, mo ní gbọ́gbọ́ máa kàn sí ẹgbẹ̀yìn dádì wa yìí náà ti gbọ́. Wọ́n lè lè kàkàn pọ̀ ẹ̀. Bẹ́ẹ̀ni, tá bá kàkàn pọ̀ ẹ̀, tá bá tún obìnrin náà bá tún wò pé tó, òun náà ti ara tòun, ó ti dúró déédéé. Ẹni tó kàkàn pọ̀ ti bí ìyẹn fèrè bẹ́ẹ̀ni. Ẹ bá ti lò ó, bá ń sọ fún wa, wọ́n ní kò sí ní tó jọ. Ẹ gbá bọ́ọ̀lù yín tẹ́ pé yóò kó ní ọ̀rọ̀ over the bar ni bó ṣe máa jẹ́ nìyẹn. Tẹ́yìn náà ṣe kíni tínú yín á dùn. Tó bá jẹ́ pé ẹgbẹ́lẹ̀ tó ti sọ sílẹ̀ yẹn náà ni ṣùgbọ́n kinní kan ni bá mi lọ sọ́dọ̀ dókítà kí wọ́n ṣàyẹ̀wò ara rẹ̀ dáadáa, wọ́n ṣe lálùkọ̀rọ̀ yìí kọ́ ọmọ bá tẹ̀ ní ẹ̀tẹ̀ ní mọ̀ ń kó bá ní àgbò òun ṣe jù. Ire àtànú Elédùmarè yóò wà pẹ̀lú wa. Ẹ wo àdúpẹ́.